Hi, good evening, everyone. This is Sunita, and welcome to my presentation. Today, I am going to explain to you about syllabus of mental health nursing of our BSC nursing third years, and in that, I am going to explain to you regarding how many units it consists of, and what are the subtopics included in each unit. Okay, and let's see the units one by one. Okay, and here you can see the first unit, that is perspectives of mental health and mental health nursing. And so in this unit you must learn what is mental health, and the definition of mental health, and components of mental health, indicators of mental health, and what are the characteristics of a mental health person, what it mean by mental illness, definition of mental illness, and evaluation of mental health services and treatment, and history of psychiatric nursing, nothing but development of modern psychiatric nursing, and prevalence and incidence of mental health problems and disorders, and about mental health act, and not only that, in that about the mental health care bill 2013 and reasons to bill, and next national mental health policy, and national mental health program, and about the mental health team, and about multidisciplinary team, and nature of mental health nursing, scope of mental health nursing, in that scope, role of psychiatric mental health nurse in contemporary mental health care, focused area of psychiatric nursing practice, and current issues and trends in care, challenges in psychiatric nursing, and education programs for the psychiatric nurse, and standards of mental health nursing, development of code of ethics, and legal aspects in psychiatric nursing, promotion of research in mental health nursing, cost effective nursing care, focus of the care, functions of mental health nurse in various settings, practice setting for psychiatric nurses, functions of psychiatric nurse in various settings, and factors affecting level of nursing practice, concepts of normal and abnormal behavior, and models, medical model, statistical model, socio-cultural model, and behavioral model, and the mental health, mental illness continuum, and mental health continuum model. Okay, so these are the topic included in first unit. And next, let's see the second unit, principles and concept of mental health nursing, and what is psychiatry, difference between the psychiatry and psychiatric nursing, signs and symptoms of mental illness, in that alterations of personality and behavior, alterations of biological functions, disorders of consciousness, disorders of attention and concentration, disorders of orientation, and volitional disturbances, disorders of motor activity, disturbance of posture and expression, disturbances of motor speech, disorders of perception, disorders of mood, disorders of memory, disorders of thought, disorders of intelligence, disorders of insight and judgment. Then next term, classification of mental disorders, and purpose of classification, ICD-10, nothing but International Statistical Classification of Diseases and Related Health Problem, and Indian classification. Next, review of personality development, factors influence personality, theories of personality development, defense mechanism, and maladaptive behavior of individuals and group, stress, crisis and disaster, etiology of etiology like biopsychosocial factors, predisposing factors, precipitating factors, persuading factors, and biological factors, physiological factors, psychological factors, social factors, and psychopathology of mental disorders, review of structure and functions of brain, limbic system and abnormal neurotransmitters, nervous system, brain and behavior, integrative function of nervous system, neuron, about neurotransmitters. Then general principles of mental health nursing, in that so we have 12 principles in that in mental health nursing. And next, standards of mental health nursing, And next, qualities of psychiatric nurse, and here they given qualities also. And not only that, about psychiatric nurse skills of psychiatric nurse, and conceptual model and role of nurse, and in that existential model, psychoanalytical model, behavioral model, interpersonal model, medical model, nursing model. And so this is about second unit. And next you see the third unit, that is the nursing process in psychiatric nursing and assessment of mental health status. So in that, you can see the topic what it included, about nursing process. And in that nursing process, so whatever nursing process we are learning in all the nothing but in the nursing foundation, then the same steps we can follow, like nursing assessment, nursing diagnosis, planning, implementation and evaluation. And next, methods of assessment in psychiatry, like mini-mental status examination, neurological examination. And investigation in psychiatry, like routine investigations, electrophysiological test, brain imaging test, and neuroendocrine test, and genetic test. And not only that, other psychological tests like instruments for assessment of symptom, instrument for assessment of personality traits and disorders, instruments for assessment of cognitive function, instruments for assessment of psychodynamic, instruments for assessment of environmental stresses, role of nurse in psychological assessment. The next unit, therapeutic communication and nurse patient relationship. In that, so what is the communication, types of communication, elements of communication, therapeutic, what it mean by therapeutic communication, and characteristic of it. Next, techniques of maintaining therapeutic communication, ineffective and non-therapeutic communication difference. Next, therapeutic nurse patient relationship and types of relationship, then components of it, and characteristic of therapeutic nurse patient relationship, ethics and responsibility, dynamics of therapeutic nurse patient relationship, phases and tasks of therapeutic relationship, therapeutic impasses, intervention to overcome therapeutic impasses, and about the process regarding this process regarding very very important in this psychiatric nursing. And later I let you know how to take this process regarding history. The next one, unit 5, that is the therapeutic modalities and the therapies used in the mental disorders. In that, physical therapy, what is physical therapies, and what are the physical therapies, and psychopharmacology, and like drugs. Okay, so what are the drugs included in this psychiatry, and you can see antipsychotics, antidepressants, lithium and mood stabilizer drugs, anti-anxiety drugs or hypnosedatives, anti-Parkinson's agents, anti-abuse agents, drugs, or anti-craving drugs, like drugs used in child psychiatry and geriatric consideration, and ECT. And this is also very very important in psychiatric nursing. Why? Because it is the only procedure we can use in this psychiatric field. Okay, the next, light therapy and repetitive transcranial magnetic stimulation therapeutic community. And not only that, psychotherapy and psychoanalytical therapy, and individual psychotherapy, cognitive therapy, what is supportive psychotherapy, family and marital therapy, group therapy, behavioral therapy, play therapy, what is psychodrama, music therapy, dance therapy, recreational therapy, relaxation therapy, and last, role of nurse in psychological therapies. And next, apart from that, we have one more topic, what is a complement and alternative therapies in psychiatry. And in that, principles, types of camp therapies, like acupuncture, ayurvedic, homeopathy, naturopathy, art, music, dance therapy, spiritual healing, prayer, herbal therapies, aromatherapy, special diet therapies, mega doses of vitamins or minerals, then tai chi, qi gong, massage, biofield therapies, psychiatric disorders and related camp therapies, and role of psychiatric nurse in camp therapy, then occupational therapy also. The next unit, you can see nursing management of patient with schizophrenia and other psychotic. This is also one of most important topic in this psychiatry. And schizophrenia, types of schizophrenia and the causes of schizophrenia, psychopathology of psychopathology. Here the psychopathology is nothing but it's similar to pathophysiology of MSN, in MSN. Okay, pathophysiology in MSN and in other subjects also. So whatever we hear pathophysiology from other subjects, so in psychiatry we can call pathophysiology as a psychopathology. Next, clinical manifestations of the schizophrenia, clinical types of schizophrenia. Then diagnosis, treatment modalities, and nursing management of schizophrenia and other psychiatric disorders. And next one, geriatric consideration, follow up, home care, rehabilitation for schizophrenia patient. The next unit you can see, nursing management of patient with mood disorders. Here we can discuss about the mood disorders. Okay, classification of mood disorders, what is mania, what is depression, what is bipolar disorder. Okay, here you can see manic episode, depression episode, and definition of mania, etiology, nursing management of mania, and next clinical manifestation of mania. And in the depression, in this topic depression also we can see definition, etiology, diagnosis, treatment modality, clinical features also. Then next bipolar mood disorder. We can also call bipolar affective disorder, manic depressive disorder. In this classification, etiology, diagnosis, treatment, course and prognosis of mood disorder, recurrent depressive disorder. What is the next one? Persistent mood disorder like cyclothymia, dysthymia, and geriatric consideration, follow up, home care and rehabilitation, and patient and family teaching like patient and family teaching mania. Okay, the next unit, nursing management of patient with neurotic stress related somatoform disorder. So in this you can see what topics it included. Okay, here you can see phobic anxiety disorder and classification of phobic anxiety disorder, types of phobia, etiology, cause, diagnosis, treatment, nursing management, nursing diagnosis, and nursing evaluation. The next panic disorder, classification, etiology of anxiety disorders, both panic and generalized anxiety disorder, clinical features, course, diagnosis, treatment. And general anxiety disorder like clinical features, course, diagnosis, treatment modalities, nursing management and evaluation. Then OCD, it is also very important topic, like you can see the definition, classification of this OCD, etiology, clinical manifestation, course and prognosis, diagnosis, treatment, nursing management, nursing diagnosis, evaluation. Then reaction to stress and adjustment disorder, acute stress reaction, post PTSD, adjustment disorder, conversion disorder like dissociative motor disorder, dissociative convulsions, hysterical fits or pseudo seizures, and dissociative sensory loss and anesthesia. Then dissociative disorder like dissociative amnesia, dissociative fugue, dissociative identity disorder, multiple personality disorder, trance and possession disorder, and others dissociative disorder, etiology of conversion disorder, and diagnosis, treatment modalities, nursing management. Then somatoform disorder, definition, what is hypochondriasis, and somatoform autonomic dysfunction, persistent somatopain disorder, diagnosis and treatment modalities, nursing management. Then next other neurotic disorder, geriatric consideration, follow up, home care, rehabilitation, neurotic disorder. Then nursing management of patient with substance abuse disorder. So in this we can learn classification of substance abuse disorder, commonly used psychotropic substances, and causes of these psychoactive substance disorders, and consequences of substance abuse, alcohol dependence syndrome, and other substance use disorders. And next like other substance abuse is nothing but you can see opiates, cannabis, cocaine, Okay, the next one, general nursing interventions for patient with acute drug intoxication. The next, prevention of substance abuse disorder, rehabilitation, geriatric consideration, follow-up and home care. Then nursing management of patient with a personality sexual eating disorder. So here we can learn personality disorders, incidents, classification, clinical features, nursing intervention, what is antisocial personality disorder, histrionic personality disorder, narcissistic personality disorder, borderline personality disorder, then dependent personality, OCD, and nursing management for this personal disorders, geriatric consideration, follow-up care, rehabilitation for personal disorder. The next you can see sexual disorder, like classification of sexual disorders, gender identity disorders, psychological and behavioral disorders, and disorders of sexual preference of paraphilia and sexual dysfunction, nursing intervention for this sexual disorder patient. The next one, psychophysiological, psychosomatic disorder and eating disorders, sleep disorders also we can discuss. The next, nursing management of childhood and adolescent disorders, including mental deficiency. Okay, mental retardation is very important question in psychiatry. Okay, here you can see classification of these disorders, and in that mental retardation, mental challenge individual. And we can also discuss disorders of psychological development and behavioral and emotional disorders with the onset usually occurring in childhood and adolescence. Okay, and in this mental retardation, epidemiology, etiology, classification, behavioral manifestation, signs and symptom, diagnosis, prognosis, treatment, prevention, care and rehabilitation of mental retarded, and nursing management. Okay, the next next unit, we can say nursing management of organic brain disorder. Nursing management, in this we can discuss classification of organic mental disorders, dementia and Alzheimer's disease, chronic can also called chronic organic brain syndrome, incidence, etiology, stages of dementia, warning signs of Alzheimer's and dementia, clinical features for Alzheimer's and causes, prognosis, diagnosis, treatment modalities, nursing management. And vascular dementia can also call multiple infarct dementia, etiology, signs and symptoms, diagnosis, treatment, nursing intervention. Then delirium, acute organic brain syndrome, incident, etiology, clinical features, course, prognosis, treatment, intervention, nursing. And organic amnestic syndrome, clinical features and management, etiology. And mental disorder due to brain damage, dysfunction and physical disease, personality and behavioral disorder due to brain disease, damage and dysfunction, etiology and management. The next unit, psychiatric emergency and crisis intervention. So in this we can discuss about types of psychiatric emergencies, what is violent or aggressive behavior for excitement, panic attack, catatonic stupor, hysterical attack, transient situational disturbances, delirium tremors, epileptic furor, acute drug induced extrapyramidal syndrome, drug toxicity, victims of disaster, rape victim, stress adaptation models of stress, coping resources, coping mechanism, grief, theories of grief. Then grief process, principles of counseling, techniques of counseling is also very important topic. And crisis and crisis proneness, types of crisis, phases of crisis, signs and symptoms of crisis, process of crisis and crisis intervention, principles of crisis intervention, techniques, geriatric consideration, role of nursing crisis intervention, modalities of crisis intervention. Then legal issues in mental health nursing, legal issues in mental health. So in this we can learn about the Indian Mental Health Act, sections, history, reasons for enactment, objectives of Indian Mental Act, and silent features of Act. Then admissions on voluntary basis, and in that 10 chapters also we can discuss. And admissions on voluntary basis, admission under special circumstances, and admission under authority or order. The next chapter 4, next positive qualities of MHA 1987 347, nursing implications. The next we can also discuss Indian Lunacy Act, Mental Health Care Bill 2013 348, and reasons for bill, key features of bill 348. Okay, reasons for the bill and key features of bill and its chapters. Okay, Then next, so actually these 348 is the page number of this topic. Okay. And next, basic rights of mental ill patients and nursing responsibility. Then forensic psychiatry. What is forensic psychiatry? Then acts related to narcotic and psychotropic substance and illegal drug and trafficking, and admission discharge procedure, roles and responsibility of nurse and legal responsibility of nurse. The next, chapter 15, community mental health nursing. Okay. Next unit, and in that what is we can discuss what is community mental health, and here organization of mental health services in India, some, and next some programs in mental health, and national mental health program, and a district mental health program, institutionalization and deinstitutionalization, and models of preventive psychiatry, and levels of prevention, role of nurse in prevention of mental illness and psychiatric rehabilitation. Then mental health services available at the primary, second and tertiary level, mental health agencies like a government, voluntary or national or international. Okay. Then next, what is community mental health in psychiatric nursing, and misconceptions about mental illness, and mental health nursing issues for special population, adolescents, women, elders, victims of violence and abuse, handicap, and aviates, HIV or AIDS, HIV or AIDS, and psychosocial aspects of HIV or AIDS, and nursing management also. Okay. So these are all the units of mental health nursing, and total it consists of 15 units. In that 15 units, almost all the units are very important.